On behalf of the Spa City Review, we'd like to mention that during this epidemic, all of us are forced to work remotely. Therefore, we have experienced some audio and video impairments. However, we feel that this conversation was very valuable, and we would love to still share it with you guys. We'll be working to improve our connection issues for future shows, and thank you very much for tuning in. Hello, Saratoga. This evening, we're joined by two very important guests. First, we have Jasmine Tucker. Jasmine is a hospitalist physician assistant holding degrees from University of New England and University of North Carolina. We're also joined by Dr. Sonya Sidhu. Dr. Sidhu is a graduate of the St. Clair's Family Medicine Residency Program in Schenectady, where she served as chief resident. She obtained her MBA from the George Washington University School of Business. She's been practicing as an attending hospitalist physician in the Capital Region for the last 15 years, during which time she has earned the designations of Fellow of Hospital Medicine and Fellow of the American Academy of Family Physicians. She served 3 terms as president of the Medical Society of Schenectady County and was also board chair and vice speaker of the New York State Academy of Family Physicians. She is currently working at a hospital covering inpatient medicine and critical care. Thank you for joining us. Appreciate you guys coming on tonight. Thanks a lot.
Absolutely. Thank you.
Yeah, wonderful. So I just want to start here by saying that this conversation is very important to me personally. So I'm really happy that both of you agreed to come on this evening. My reasoning for that is just that when I'm trying to get a feel for what's going on in terms of where we are today, what our realistic timeframes are, every other thing that's affected by this, the one thing I can look at is really what's happening in the medical community to really determine, the answers to all of those things, because until this problem is solved in the medical community, it seems to me that we can't really answer the other questions. So I just want to start and ask, how's your daily work impacted today, where you're at? What challenges are you guys facing on a day-to-day basis?
I'd have to say, trying to limit exposure, not only to ourselves, but of course, I live alone, but I know Dr. Sidhu has family, has children. And I think just the daily work impacted by the epidemic is just trying to keep ourselves safe, as well as our families.
Yeah, we have to make sure we not only keep ourselves safe from infection, but when we go from patient to patient, we have to change, our gowns in between. And as Jasmine mentioned, I do have kids, and I actually have not seen them in 3 weeks ever since this whole thing started, just to make sure that I don't accidentally infect them.
That's hard. I have kids, so I can only imagine how difficult it is. The only upside being that you're somehow getting out of homeschooling right now, which is
that's right.
An interesting thing.
That's right. And they're weird kids. They're actually self-motivated. They wake up early and log in and do their homework themselves, which is really strange. But
that is amazing. I wish I could say the same about my 2. How are you guys as far as your supplies and resources? Are you able to get all of the things that you need, masks, ventilators, things of that nature?
As of now, we are. If this gets much worse, though, I'm afraid we might run out. Even the N95 respirators, we're down to every nurse, every doctor, everyone that has contact with a patient that's positive gets one N95 respirator for that entire shift, whether it's 8 hours or 12 hours. And ideally, you would be changing the respirator in between patients. So, that's actually quite challenging. They're using a disinfection process at the hospital. They're going to start doing UV light disinfection of all the masks and all the N95s at the end of the day. But ideally, we would be changing all of our PPE in between every patient counter. So it's a little weird.
Do you guys feel as though, it ended up here, when it did, but it's not like we didn't know that other countries were experiencing this months before it ended up here. Do you feel as though the medical community could have or should have been more prepared to handle it?
And I'm just going to speak to this personally. I really don't think, I think when it started hitting China and then, of course, to Italy, we really didn't realize how bad this was going to be and how this is going to impact our whole community, our families, schooling, businesses, the hospitals, basically up until it happened when it did. I certainly don't feel like we knew that everything was going to shut down. We knew we were going to have to quarantine until basically the week before it happened, or at least that's from personal experience. I think when it got so bad in Italy, and when we started seeing reports regarding the physicians and the nurses over there, a week later, it seemed like it was here.
Just to follow up on that a little bit, because we're always hearing about how people are having trouble getting the supplies they need in terms of ventilators and masks and everything. What avenues are separate hospitals and medical facilities taking? What's available to them in terms of accessing these resources?
So most hospitals usually buy their own. And prior to this, coronavirus outbreak, we had adequate supplies of everything for what we needed them for, like the special respirators usually for TB patients. We had enough masks to use for influenza. We had enough gowns for the standard things we use contact precautions for. I think the main thing is that because this is so large scale, we were not prepared for this, and nor can any hospital really be, because we buy a certain amount of equipment. We can't buy too much excess because we not only don't have the budget for it, we don't have any place to store it. So this is really where the government would come in and help. And in fact, we do have national stockpiles of ventilators, et cetera, some state stockpiles too. And these are here specifically for such pandemics to help us ahead of time. For whatever reason, it seems like we were probably a little less prepared from a government resource standpoint this time, but I don't want to make it political. So I don't know why that is. It may just be that that's how it is. So.
Yeah, I definitely try with political landmines too in this conversation, which can be difficult at times. But as far as separate hospitals and how supplies are distributed to each one, is it having a big impact on you that when patients are being moved from New York City, for instance, upstate in large numbers, of an impact does that have on how prepared you are with supplies?
So the amount of patients we have so far is not that many. And I think each of the hospitals has gotten maybe between 5 to 10 patients. So it's not a huge impact, but I mean, the fact remains we're still better prepared than the hospitals downstate are. So we're still in better shape to accept the patients as far as supplies go.
I agree. Yeah.
What are your prospects for the near future as far as that's concerned? What are your biggest concerns and biggest hopes as we come into the coming weeks?
I think some of the biggest hopes we have, and we're already starting to see this, is especially with being able to test and getting a test that we have the results in 20 to 30 minutes. I think that's going to help the process where we're not having to quarantine and use up hospital space in certain cases for 2 days, because now it's taking up to 48 hours for the test to return. I think people can move on with their lives knowing that they're negative. So I think that's going to be a big plus. Also, having more information on how we're treating this and how the outcomes of the treatment are affecting these patients, and just knowing more about, I guess, how to move forward socially as well.
Yeah, I think just expounding a little bit on what Jasmine said, I totally agree with her, especially as the disease spreads. We have much more or larger numbers of patients that we can actually get data from as far as what treatment protocols work, what the disease process is, what the complications are. Because, initially we said, oh, it really only affects older people. Then we said, okay, older people and those with comorbidities like diabetes and hypertension. And now we're we're at work, it affects kids too. It affects young, healthy people. So we're learning more about it as it's going on. And we've got several 100,000 cases now. So we have more data, and, the treatment protocols that we're trying will have more data on that too. My biggest concern is we keep hearing stories out of Italy, for instance, and Spain of where they've run out of ventilators and ICU rooms, and maybe even physicians and nurses and PAs and, nurse practitioners, to the point that they aren't even able to treat everybody and that's my fear, that, I don't want us to get to that point where we're making decisions like, oh, this person, can get the vent versus this person. And then how do you decide? Because, one of the things in our medical ethics in the United States of America is that no one life is necessarily more valuable than any other life. So, these are not decisions that I hope to ever make, ever, as a physician. So that's my biggest concern, because we keep hearing that this is what's going on now in some of the European countries.
In those situations, do they determine those needs, but based off of a checklist in terms of like age, comorbidities, as you mentioned, other factors? Is there like a number chart, and then whoever's the highest, gets the life-saving equipment?
So they've actually started to release protocols on how to do that. And there's one out of New York State. I haven't reviewed the whole document yet. I think I was just, trying to pretend it didn't exist. But eventually it will be based on a point system. But the main thing that you look for is who would be most likely to benefit from this, who would recover from the disease if they had this treatment, as opposed to would this person not recover. But yeah, I think most of the state medical societies and health departments have developed a protocol which does involve a ranking list to choose a score, basically. But again, that's something that I hope to never have to do. So,
of course, yeah.
I'm sure that's not something that anyone ever would want to do.
No.
We've seen reports recently that the death rates are lowering in New York. Your knowledge, what kind of information does that give us, if any, in relation to the increased positive results that we're seeing for people testing positive for coronavirus?
So actually, I believe as of today, the death rate is still increasing, or yesterday it was more than it was the day before, but the hospitalization rate is decreasing and the critical care hospitalization rate is decreasing. So ideally, if we were testing everybody that had symptoms and needed to get tested, that would probably mean that, more people were having less severe forms of the disease. However, we're really not testing everybody that needs to be tested because we just don't have availability of test kits. We're making presumptive diagnoses sometimes just based on symptoms and, other factors. There was a patient the other day, actually, we saw, who came in, had known contact with a positive patient, had all the symptoms. He basically must have it, but he wasn't even given a test. And, the physician that saw him just said, okay, we'll presume that you're positive. You're quarantined for 14 days. You can go home and, blah, blah, blah. But he wasn't even tested. So, he's not even going to go into the statistics, which, is a horrible way to do public health, because ideally we should be testing everybody so we have more information. So I think the decreased hospitalization rates, they sound great. It might be too early, just having been a couple of days, to really make anything of that yet.
It's so scary. Just because I've had a sinus infection, so I called my doctor to try to get an antibiotic, and there's definitely like these certain steps that you go through just to make sure that you don't come into contact with anyone. So, I would imagine that there's a fair number of people that are asked still, even if they have symptoms, to stay home.
Right.
To not expose other people. And also, in case they don't have it, to not somehow, end up with it just by going out trying to see. So, it's tough,
Well, and the one thing that makes this the coronavirus tough, the COVID-19 tough, is that you can be asymptomatic and still shed the virus, and that's the scary part. So that's why staying at home is essential. That's why everyone needs to stay home, because again, people are shedding the virus that are asymptomatic and don't even know that they're shedding the virus. Also, testing. Right now, I believe we're seeing a lot of false negatives, meaning that you're actually positive when you test negative. I know that we've had a couple of cases at our hospital. And when we retested them, of course, they came back positive on the second test. So that's why staying home, wearing masks when you're out in public is really essential right now, because you're not wearing the mask to protect yourself. You're wearing the mask to essentially protect the other person.
Right. Do you ladies think that there are any resources that you might recommend for average people to educate themselves on how to behave responsibly?
I certainly think resources like the CDC, and in our particular state, New York State Department of Health websites are key. Sonia, do you have anything to add to that?
No, I think those are the two big ones. A lot of hospitals in the community have also set up hotlines if you have questions. They have their own informational stuff out there, but particularly the State Department website actually links you to the CDC as well. I've been all through the website. It's fabulous. It has tips on what to do, explain what it is. If you do analysis in New York State on a daily basis of how many positives there are, how many deaths, etc. So I think that those are the two biggest resources.
Yeah, I saw on the CDC website too, they even had like a COVID questionnaire that you could kind of like follow. And if you answer the questions,
that's right.
And if you were to answer yes to those, then you should do these things.
Yeah, I think it's a checklist sort of to advise you on whether you should stay home, whether you should go to a hospital because it's an emergency, or whether you should call your physician, call the health department website. I've done that too. I plugged in my own answers. I made up different answers, and it's actually pretty accurate.
Oh, that's awesome. That's awesome. And I think that's exactly the kind of resource that people need. Yeah. Especially when
absolutely,
I think a lot of people are scared. They don't really know how they should feel, or if they have like one symptom, if it's if they should be worried without having all of them, or
I think the biggest thing is if there's ever a question that's not answered quickly enough for you, to call the health department of your state or your county. They'll be the best resource for that. In Albany at the New York State Health Department, they have tons of epidemiologists manning the phones just for that reason. So if you're ever not sure, you're getting conflicting information, just call the health department and they'll tell you.
That's awesome. I feel like a lot of people probably don't know that, so that's great. Do any of your peers, people that you guys work with, think that we're overreacting to COVID?
Yeah, absolutely not. I think everyone in the medical community knows how deadly and how serious this virus is. So no medical professionals that I work with personally, friends that I don't even work with, absolutely not. They're seeing front hand how it's affecting everyone, and how even younger people my age, how even some of them have lost their lives to corona. I actually lost a classmate of mine that went to high school. She was 35 years old. So yeah, absolutely not. I don't think at all that peers think that we're overreacting.
And I mean, it's politicized, but I think the medical community, regardless of political persuasion, is all on the same page with this, because I mean, the medicine, the science of it, those are facts. So
yeah. And I think it's since the very beginning, everyone has sort of had an opinion about how serious or not serious it is. And, obviously you two being medical professionals, better than anyone else. But I know that, especially now we're all kind of more involved in social media. So we see friends, family that are maybe choosing not to social distance, or are saying that this is silly and, there's no reason for all this to be happening, or, that it's some crazy, media scheme. What would you guys have to say about that? Or what would you say to somebody that said something like that to you?
So I'm very active on social media, and I've made it my mission over the last few weeks to debunk anything that is not factual. So I've seen things floating around that say, oh, drink warm water every 20 minutes and it'll kill the virus. So anytime I see something like that, I'll put out a post explaining why it's incorrect, what the correct information is,
got to be the right information though. Like all the circulation of I feel like when I spread the right information, I'm just like, you know, I'm just blowing in the wind, and there's just so much bad information
Right.
out there. It seems, and one of the biggest things that personally has annoyed me is the incessant comparison of COVID-19 to influenza, and it's like you see the meme, and if you see a meme with numbers on it, then it's, you know, it has some credibility, but it's just a comparison of death per year. And so, according to you guys, what are the most important distinctions between COVID-19 and, you know, the common flu?
I think the most important distinction is that this virus can shed when you're asymptomatic. When you have the flu, you know you have the flu. If you have COVID-19, you don't necessarily know that you have it. You could be asymptomatic. So I think that's the biggest thing that causes this virus to be more of a threat. Absolutely.
Yep, I agree 100%.
Yeah, just the nature of how it travels. Just a quick anecdotal thing. You know, I was very sick like 5 weeks ago, and looking in retrospect, had many of the symptoms, and it was like this is the sickest I've ever been in my life. And it's amazing to me how many people I know who had the same exact story, but they were never treated, you know, and never. So there's just that incubation period or whatever it's called when somebody's not symptomatic but they're spreading it. That's been very scary to me. But this strain, my knowledge is that there are multiple strains of coronavirus that leads to COVID-19. Could you guys elaborate a little bit more on that, and what the differences are, and why this one in particular is so much more deadly?
So I want to say, I know that coronavirus actually started off, it's a zoonotic infection, meaning that it typically occurs in animals. They think that the COVID-19 originally started in bats, and then somehow adapted to where it's affecting humans. Certainly we've had other coronaviruses in the past, one of them being SARS, the other one being MERS, and that was, I believe, back in 2002, 2003. The difference between SARS is that when you had it, you were sick. As I just said previously, with coronavirus, you don't necessarily have to be sick to have the virus, and that's a huge difference between this strain and previous strains.
Just a reminder that the many strains of the common cold are also caused by coronaviruses. So,
Yep.
you know, we've actually been exposed to numerous coronaviruses throughout our lifetime, probably since infancy, but most of them were certainly milder. Like I said, it was the common cold. This one is, you know, they call it the novel coronavirus because it's a brand new type of coronavirus. And I think that's the biggest thing, is that our immune systems have never seen it before, so they don't really know how to react to it. And some of the patients that are getting the most ill from it are doing so because of a strong immune reaction. You know, the body's trying to fight it off. So you get a high fever, you start secreting all sorts of things in your lungs to try to fight it off and get rid of the bug. So the immune response is so strong because we've never really encountered this particular version of it before.
And I actually want to go back to what we're discussing, which makes the COVID-19 more of a threat than the influenza virus. I'd like to say that the biggest thing that we're seeing with these very sick patients with COVID-19 requiring ventilators, we don't see that typically at all with influenza. I mean, certainly those people that would require intubation are people that have medical comorbidities, existing medical conditions such as COPD, such as heart failure, such as an associated pneumonia. Now with COVID-19, you know, even people that are healthy are still getting this and having to be intubated. And so we just don't typically see that with regular influenza.
Mm-hmm. Understood. Yeah. I wanted to shift gears a little bit here because I've been hearing recently and this of course comes to me via the internet, but Bill Gates has been in the headlines with his participation and trying to get a vaccine developed. And my understanding is that a year away, roughly at best, in order to run enough trials for a long enough period of time. In the meantime, we've had leadership suggest that we would be able to treat the symptoms of COVID-19 with drugs that are not tested against it. Is that dangerous? What type of risk does that present while we're waiting for this vaccine? How should we best go about treating symptoms?
So it could be risky, and we're actually using the hydroxychloroquine azithromycin combination at our hospital where Jasmine and I work. But we don't use it on everybody that has it. We use it on people that are, high risk to have very, very bad complications respiratory wise, where they could benefit from this. That having been said, the combination can also cause cardiac arrhythmias, heart attacks, et cetera. And often the people that have the comorbidities are also more prone to that as well. So the fact that it hasn't really been tested on a wide scale, we don't know what type of, it could be a higher side effect profile than we realize, or a larger one, a more deadly one than we realize. On the other hand, this actually could be a very fabulous combination. So that's why many hospitals are using it now, even before the trials are finished, because it's like a compassionate use type of exemption where, if somebody's very, very ill, their chance of mortality is pretty high. Something that maybe hasn't really been fully studied yet can be used because there's a chance it could work. Whereas if we didn't do anything at all, the patient would most likely not make it anyway. So it's like it won't really necessarily harm you, but it might help you type of thing. Certainly, using it without a physician's prescription is absolutely not a good idea. That having been said, I think a lot of physicians might also be a little bit hesitant to prescribe it or really know what settings to prescribe it in. So the average person testing positive for COVID-19 that has maybe symptoms similar to a bad cold or even the flu may not necessarily need it, whereas a hospitalized patient may. But again, it's so untested and it's so brand new that, so it's not a miracle cure. Let's put it that way.
Understood. That brings up a point. A friend of mine, he works as a nurse, and he was discussing the possibility. Some of his colleagues were concerned with possibility of mutation of this virus, towards something that would be more deadly, and suggested that treating it with certain drugs that were intended to kill it, but not actually doing so, would be one way about ensuring more resiliency and adaptation. Is that correct, or how do you think about our risks in terms of mutation? This evolving something that would be more resilient to any future vaccine or anything we come up with?
That absolutely is a risk if we use an antiviral. And there are some antiviral therapies that are currently being tested too, but it would be similar to an antibiotic. Like we have these superbugs now because we used a lot of antibiotics. Typical organisms that used to cause things like pneumonia or urinary tract infections have mutated now, so only the stronger strains survived, and they were able to beat the antibiotic, and that's why now we have super infections like MRSA. And VRE and C. diff and things like that. So using an antiviral could also possibly cause the same type of thing. We don't know that for a fact because we haven't really used antivirals on a enough scale, nothing comparative to antibiotics. But the treatment protocol of hydroxychloroquine and azithromycin is not an antiviral. It's not meant to kill the virus. It's meant to basically treat the symptoms of it, I guess is the best way to put it.
Sure. Yeah. That leads into the next thought I have. So when we're thinking about the fact that the vaccination is so far away, I don't know if there's a consensus amongst you and your colleagues about how long we're looking at living with COVID-19 in large or small numbers. Is this just kind of with us until we get to that point where we can have a wide scale vaccination?
Yeah, I mean, I definitely think so. And right now we're all in quarantine essentially. But when we start going back out and being together in public, that's the scary thing, because could we see another spike in this? And that's absolutely a possibility.
Yeah.
And we don't know yet if it's going to be seasonal. Like influenza is more or less seasonal. It goes away during the summer. We don't know if that's true for this. People get, for instance, the other coronaviruses like the common cold, people get them year round, including in the summer. So hopefully this isn't going to be like that, but we just don't know yet.
It's my understanding that upstate New York hospitals are accepting some patients from the overflow downstate. And I've seen on social media that the community hasn't been entirely welcoming. I'm wondering for Jasmine and Sonya, what your experience has been at the hospital.
Well, I know right now that we have the resources to help these people from downstate New York, where their hospitals are so over, have so many patients, they're over capacity. And if we have the resources to help them, then we should. And that's exactly what we're doing. Certainly they would do it for us if the roles were reversed. Hence why Governor Cuomo has, had to take some of the ventilators from each hospitals and send them down to the city because of the lack of resources that they have right now. Also, I just want to say personally that, we're accepting these patients from the city who probably have never been out of the city before in their entire lives, and you're bringing them to a new place, not knowing if they're coming here to live or die. So that's had to be hard on them. Also, a lot of them I know speak a different language, and I couldn't imagine, being very sick coming up to a brand new place. Again, this has got to be hard on them. I know Sonya and we took an oath as medical professionals to help all people, and they are definitely included.
Yeah, I mean, we're one big state. So, ideally, I'd like to see this on a federal level. But since it hasn't been organized on a federal level, I think it's great that this is what Governor Cuomo is doing. Right now, they're totally overrun downstate, and they may not have the resources, whereas we do. Later, let's say it spreads up here more, and they start to have less cases there. Then they'll also share their resources with us. That's how it works. Ideally, I would have loved it if maybe, say, a state like Montana could have sent stuff to us, and we could have reciprocated when they needed it, but it's just not been organized on a federal level yet.
So you ladies have been working a ton during all of this. On a personal level, how have you been affected?
To be honest with you, for me personally, working is kind of keeping me sane at this point. I don't have any children or a significant other. So it gets lonely with just my dog. There's only so much cleaning you can do. Living in Saratoga, I miss the social aspect of everything, going to my favorite bars on Caroline Street, for instance, and seeing my friends. It's really hard. And it really kind of put things in perspective about, being alone, I guess. So, between work and my living room, that's about all I'm doing right now. And I think it's hard for us social butterflies.
Yep. No, I agree with her. I'm older and I have a family, so I'm not as much of a social butterfly, but since about 3.5 weeks ago, I actually separated myself from my children. I had an apartment already. But, they used to spend some of the time here with me, some of the time with their dad, or I used to stay at the house, and I haven't gone anywhere near them in 3.5 weeks, ever since the very first day that I worked in the trailer where we tested out patients for COVID-19. So I definitely miss my children. More than that, I worry about what my children, if they feel abandoned, or, one is 8 years old. She might not quite understand. The 13-year-old, I think, does understand. But that's been the big thing. And, I had a couple of friends here and there that I used to occasionally go out to dinner or lunch with. And I used to take dance lessons and things like that I can't do right now. So luckily for me, I've been working a lot. This is the longest stretch I've had off. It's been 3 days I've had off, and then I go back to work tomorrow. But it was a very lonely 3 days, actually. So just ordering takeout, watching Netflix. I'm not used to that. I'm used to doing stuff on my day off.
Well, thank you both for dedicating all of your time and energy to people who obviously need it. We wouldn't all be here without you guys. So thank you so much.
Absolutely. Thank you for having us.
Yeah, I also want to say thank you, and I mean this on a personal level, and not just for coming on the show and as an interviewer, but you guys are like my heroes right now, and I really appreciate it. So thank you so much.
Absolutely.
But it really is our pleasure. This is really what we live for. So, you know, this is why we went into medicine.